and welcome to our frequently asked questions. I'm Dr. Alvarez from Endobariatric.com, and on this episode we would like to discuss if the sleeve actually stretches out with time. Now, what we know is that some sleeve stretching is known to happen with time, especially with bigger or wider sleeves. But it is very important to understand or to mention that the sleeve will never ever stretch out to the original size the stomach used to have. Now, how much does the sleeve actually stretch out? The stretching of the sleeve has a direct relationship on how big this sleeve was made originally. Here's where the size of the bougie comes into place. The bigger the bougie used for your surgery, your original surgery, the more likely it is to have some stretching down the road. The lower the size of the bougie used for surgery, the less likely it is that you'll have some stretching down the road. Now, you may ask yourself, what is a bougie? Well, a bougie is another word for calibration tube. The calibration tube used to craft your sleeve. The wider the calibration tube, of course, the wider your sleeve. Also, important factors of sleeve stretching, very important, is the surgical technique used while doing your sleeve. It is important that the surgeon at the time of surgery removes the fundus of the stomach. That precise part of the stomach, the fundus, is the most stretchy part of the whole stomach. But it also carries a good amount of ghrelin, the ghrelin hormone, which is called the hunger hormone as well. The less fundus, the less ghrelin, the less hunger after surgery. If some of the fundus is left behind, you will have a tendency to stretch out your sleeve with time, because again, that is the most stretchy part of the stomach if you leave it behind. That is why it is very important to have this surgery done with someone who knows what he or she is doing. The sleeve it is very important for patients to understand that a sleeve does not equal a sleeve, all right? It is very dependent on surgeons, and it is artwork. It is crafted. Now, patients with sleeves will notice that restriction is amazing the first few weeks after surgery, and it doesn't stay that way. That is mainly due to swollen tissue of the stomach right after surgery. The surgery is so recent. It is not your real capacity. As the swollen tissue starts to come down, as the days and weeks go by, the stomach will have more space to hold food. Now, this of course will still be a fraction of what you used to eat prior to surgery. Please understand this. Some people may compare their stretching of the sleeve with the stretching of the gastric bypass, which is a different situation. The gastric bypass is quite different. Both etiologies are totally different. Bypass patients who regain weight or stretch the pouch is quite different, since the Roux-en-Y or the gastric bypass patients have an anastomosis, or a connection from the stomach to the intestine, that will distend along with time, along with the small intestine that it's connected to. So that will be enlarged in diameter, giving it, of course, more capacity to the patient, more food to hold. Since the sleeve lacks all these issues, you will need to focus on healthier food choices and make the most out of the weight loss, especially those first 12 to 18 months. I hope this makes sense. What I'm trying to tell you is that even though you have a nicely done sleeve, you may regain weight if you don't watch what you eat, if you don't make wise decisions, if you graze, or if you have a lot of liquid calories. So think twice before getting something to eat, all right? So I hope all this makes sense and you find this useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.